answering on the live chat over here. Yes, hello Prerna. Hope everything is fine at home. Okay, so Dr. Aniketh just called us. He's going to... Hello. Hi, Dr. Aniketh. How are you?
I'm good. How are you?
Very well, very well. We're just waiting for you.
Yeah, sorry, I just got late by a couple of minutes. Thank you for having me.
You're welcome. So, how do you want to begin with this? Should we just we'll just discuss the basics of all the three procedures that we spoke about that we had to discuss, and then take questions from people?
Sure, that sounds fine.
Oh, okay. So, what do you want to start with? Let's start with rhinoplasty, because I think that is something that a lot of my patients come to me and they ask, and that's something I've always wanted your opinion on about. Just if you could just explain the followers about what rhinoplasty is and how you go about with it in your practice.
All right. So, in simple terms, rhinoplasty is the surgery done to change the shape of the nose.
Okay.
When you're also doing work on the septum to correct breathing issues, it's called a septorhinoplasty. Now, changing the shape of the nose, different people want different things. Some people might have a very large nose with a hump, and they want that made smaller. That's called a reduction rhinoplasty. Some people, particularly from the northeast, they have a very shallow nose and they want it to be raised. That is called an augmentation rhinoplasty. So in rhinoplasty, you can do lots of things. You can make it smaller, you can make it bigger, you can make it sharper. Basically, what the surgery entails is it can be done in an open or a closed method. In an open method, we make a cut across the bottom of the nose, and the other incisions are inside the nose, and then we lift the skin. In a closed approach, we don't have this cut in the bottom. We only have incisions inside the nose. So,
okay. So one of the questions.
Yeah, I'll just finish it. Just a couple of sentences.
Sorry, go ahead.
It's done under general anesthesia, and it has a downtime like of around 7 to 10 days. You go back to work in 7 to 10 days. The results take a little while to be completely seen. You can see it immediately, but it's not the full result. The full result can take around 5 to 6 months to be seen. But then the results last lifelong.
Perfect. So this is a very good take on rhinoplasty. So rhinoplasty is basically surgical correction of the nose. It is done to correct for cosmetic procedures, also to correct the breathing. So I'll just go over the non-surgical what we do. This was surgical rhinoplasty. When we talk about non-surgical rhinoplasty, actually that term is wrong. It's actually a liquid nose job. There's nothing known as non-surgical rhinoplasty. So what we do in non-surgical rhinoplasty is we correct the nose shape with the filler. You cannot correct breathing problems. You cannot correct major defects. Minor defects, yes, you do correct. You can correct minor changes in the nose. It is a very gratifying procedure because it's an immediate result. But yes, it does not last lifelong, like Dr. Aniketh rightly mentioned. It does not have a downtime as such. But yes, if you have a breathing problem, too much of a nose defect, rhinoplasty is your go-to surgery. Has very, very gratifying results. If it's a minor defect, I think of doing a liquid rhinoplasty with fillers is a decently good option. What is your take, Dr. Aniketh, on this?
So, I mean, both of them have their place. You have your pros and cons in both. The advantage of the non-surgical rhinoplasty is that the result is immediate. There's no downtime. You're back to work the very next day itself.
True.
The disadvantage is that it is another advantage is that the initial cost for one procedure is much lower than a surgical rhinoplasty. The disadvantage is that it lasts only for a year. You would have to repeat it. The advantage is that it is lifelong. You do it once and you have the results for the rest of your life. Are you getting me? I think there's
there was a log, but you're fine. Now it's fine. There was a little stop in the middle, but now you're visible and you're audible also.
Yeah. So with the surgical rhinoplasty, the biggest advantage is that it is lifelong. And while the surgery itself costs a little bit more, it's probably more value for money as opposed to doing fillers multiple times. The biggest disadvantage, of course, is that you have a downtime. It takes you like around 7 to 10 days before you go back to work. The other disadvantage is that it's a surgery. People are afraid of getting surgery done. So what I tell a lot of patients is that it's a little bit impractical to keep putting filler in the nose for the rest of your life on a yearly basis. So if you want to do that, that's fine. Otherwise, the good way to look at it is that the filler rhinoplasty can be taken like a test drive. You do it once, you see how you like it. If you like it, then you can go out to the surgical rhinoplasty. This is what I tell my patients.
one thing that I've noticed about the nose is particularly, and just correct me if you think I'm wrong, is that fillers last a little longer on the nose as compared to.
It depends. It depends
that's one thing that I've. Yes. Yes. I'm talking about the brand which are there. Let's take Juvederm Voluma for example. I think on the nose when you do it, it does last a little. It does not. Say it lasts a little longer than a year is what I feel. It's because of less movement on the nose.
Mm-hmm. No, I would agree with that. I would agree with that because if you put it in the right plane, where you put it in a relatively avascular plane, it takes a little bit more time for it to get broken down. So yeah, I would agree with that.
Perfect. So yes, so to brief out everything that Dr. Aniketh and Dr. That I have said is that if it's a minor defect, liquid rhinoplasty is a good option. If you want something permanent, surgical rhinoplasty is of course the gold standard when it comes to breathing problems. Surgical rhinoplasty is the gold standard. A minor defect, if you want to do a trial run and see how a rhinoplasty will look in the future, liquid rhinoplasty is a good option. Can we just discuss the cost?
The one thing I would add to this is that the nose is one of the trickiest places to inject. So you should not go to a novice injector for the nose. You better do your homework and find someone who is experienced with fillers and good at fillers because you need to be safe in any filler, but I'm sure you know this. The nose is one of the trickier areas to inject compared to other parts of the face. So you should find someone who's experienced in it.
True, absolutely agree with that. It's one of nose is one place which you need expertise, and that's when you can do nose. You can't just go in, and that cannot be your first injection that you try. Let's go on to the next topic and this is something that is very close to my heart. That is CoolSculpting. Because I do CoolSculpting in Mumbai, and the most common question that patients ask me, and a lot of people have asked me that also, Doc, when liposuction, when CoolSculpting? And so if you just go over liposuction, the different kinds of liposuction, that a lot of people have that question. What is the downtime that is required? Then when do you do it under local anesthesia? When do you do it under general anesthesia? So, if you could just help us with that.
So, firstly, the biggest misconception that some people have about liposuction is that it's a weight loss surgery. It is not. No one should think that this is a weight loss surgery. It is a body shaping surgery. You might lose a little bit of weight because of it, but that's not the reason why we are doing it. We don't judge the result of a liposuction by how much you weigh on a weighing scale after the surgery. We judge the result by how you look in the mirror and how you feel about yourself. So that's the first thing that I want to clear about liposuction. Now, in liposuction, what do? We make a few small holes of around 3 to 4 millimeters in the skin. Through those holes, we suck out the fat that is just under the skin. We suck out the fat between the skin and the muscle. We cannot do anything about the deep fat that's inside your belly. That is known as visceral fat, and that can only be reduced by exercise. Now, traditional method of doing liposuction is under general anesthesia, where you're completely unconscious. I prefer to do most of my liposuction under local anesthesia. I do it this way for a couple of reasons. One, it makes the procedure quite safer. You don't have any risk of general anesthesia. Second, the fact, like the most is during the surgery, the patient can stand up. So I can see how he is looking, make him lie down, do a little bit more. So I love that. It helps me give better results. Now, the only downside to doing it under local anesthesia is there's a limit to how much you can do under local anesthesia. You can't do chest, tummy, thighs all in one session local anesthesia. You would have to break them up into sessions. That is where the general anesthesia has an advantage. So, in general, my preference is local anesthesia. I like to counsel my patients to have it done in sessions rather than the whole thing done at once. If someone doesn't have that luxury for whatever reason, they're coming from out of town or whatever, and they want multiple sessions done in one go, then I would opt for general anesthesia. Now, coming to your question of liposuction versus CoolSculpting, I believe, this is where I suppose we would be a little bit on the opposite sides of the coin, me being a surgeon and you being a dermatologist.
No, but to be honest with you, Dr. Aniketh, any of my patients who come and with a BMI which is too high, and the fat is too much, I refuse CoolSculpting, and I've done it so many times. So to be honest, I feel that both of them have their place, and just sorry to interrupt you, but yeah, I feel that liposuction is absolutely it's not. I'm not going to disregard the procedure at all. I think it has beautiful results, and that's why I tell all my patients also.
No, even CoolSculpting has its place. In my opinion, you can disagree with me on this. I find CoolSculpting to be best when there are small fat pockets, particularly the double chin, particularly the love handles, where it's not big enough for a patient to feel that he wants to undergo a surgical procedure. I feel that that's where CoolSculpting would work best. And as you rightly said, those who have a lot of excess fat, CoolSculpting might not work as well. It might not be as cost effective. And I'm glad that you said that you would counsel the patients against it, because there are plenty of unscrupulous people who would still go ahead and do it knowing fully well that it's not going to give any result.
I think that's what differentiates a doctor from a businessman. I think that is we.
Hello, am I back?
Yeah, you're back. Just a few points to add in CoolSculpting. So some certain areas, like Dr. Aniketh said, the double chin, the love handles, the abdomen do have very good results with CoolSculpting. Talking about fat, it's not just the very small pockets of fat. If you do repeat sessions, you do see good results. I am a example of this. I have done CoolSculpting on myself, and I feel that it would be very wrong to say that. It would not be very wrong, but I think it would be incorrect to say that it's just for very small pockets of fat. Mm-hmm. It does treat a very limited quantity. You need to repeat the cycle, is what I would repeat.
I mean, your experience in this is more than mine. I don't do CoolSculpting. Another thing that I would want to add in this is that I think it's important that people see what the technology is and what the doctor is. Because I've had a couple of patients come to me where they called it CoolSculpting, but I'm not sure if it was CoolSculpting. It might have been some other brand or machine. And they come to me with huge scars. That entire handle that you put on the abdomen, the entire square outline of that had produced an area of hyperpigmentation, and they came back. So again, you need to, no matter what you are doing, you need to do your homework and make sure that you're finding someone who's qualified to do it.
True. So CoolSculpting is the only... so the technology is cryolipolysis, and CoolSculpting is the pioneer in it. It's the only one which is US FDA approved, and fat burns I've not seen that many burns, so much PIH with CoolSculpting. But yes, I have seen similar cases like you, which claim to be CoolSculpting, but they're not CoolSculpting. So you have to check the provider online or check for the authenticity of the doctor before you go in for CoolSculpting. Same with liposuction, guys. Liposuction, make sure it's not something which it's a very, very technical, and you see Instagram, people think it's very simple. There's a lot of hard work that you need to go through residency, plastic surgery. It's a lot of hard work. So especially if you're talking Instagram, don't just believe everything that you see on Instagram.
Instagram has a tendency to make everything seem minor, seem easy. That's not always the case.
True. Okay, I think we're done with two of the procedures. Just the one final one. I
think there's one question I'm seeing on the screen. Do either of the procedures leave you with loose skin or stretch marks? I'll take the lipo part of it. So stretch marks, no. It's not going to give you stretch marks. It's not going to take away stretch marks either. The stretch marks that you have, this is not going to increase it, but it's not going to reduce it either. Now, the point of loose skin, that is a very good question that a lot of people have. I would say that it depends on what your skin quality is. For someone who has good skin quality, who is not too overweight, the skin shrinks and contracts back very well. It is not an issue. If someone who has has multiple pregnancies and they have a lot of extra skin in the lower part of their abdomen, in that case, doing just liposuction would not be enough. You would be left with this kind of hanging curtain of skin. In that case, the only way to get rid of that excess skin is by a tummy tuck. The same thing is true for someone who has had a massive weight loss. Someone who was, 120 kilos, they came down to 75 kilos. Those kind of people also would have a lot of excess skin. And this is damaged skin. It does not have the ability to contract back. So in those situations, you would have a little bit of excess skin, and you might need a tummy tuck to take care of that.
About the CoolSculpting part of it, if you have that much of fat and that much excessive skin, you're not a candidate for CoolSculpting. Whether people with normal fat, when they do CoolSculpting, no, they're not left behind with any loose skin. There are few studies which claim that it's not meant for skin tightening. CoolSculpting is not meant for skin tightening, but few studies that claim that cold as such does not cause the skin to lax a little, so does not make the skin loose in any way, because there are a few people claiming that the skin will go loose. So that does not happen with CoolSculpting. Yes, but it's not the treatment for loose skin. If you have loose skin, the treatment is, if it's a minor thing, you can go in for a few non-surgical options. If it's major, tummy tuck is the gold standard again.
Generally, that question of loose skin, usually in my experience, is in women who have had multiple pregnancies. And honestly, the only thing which can really fix it is a tummy tuck. Anything else for that level of excess skin is pretty much a waste of money.
True. Agreed. You need to differentiate whether it's loose skin and fat. That's something, again, the doctor has to do for you. Whether you have, it's not something you can do at home, because it's very difficult to differentiate whether you have fat or loose skin. That's another reason why people say that CoolSculpting didn't do well for them, is because the doctor actually treated the loose skin. He didn't treat the fat. If you treat the fat and if it's done properly, the fat does go away. I think we'll go to the next one, that is about facial aesthetics. This is I'll start with this one, with facial aesthetics. So when it comes to facial aesthetics, the two main things that we do are Botox and fillers. So botulinum toxin and fillers. So these are both anti-aging treatments. Botulinum toxin is something that we do to relax muscles around the expressions of the face, not to make you not to mask your expressions, but just to soften the expressions. And fillers are something that you do to do a lift, to readjust the fat pads, to cause a little sculpting, to do a little structural definition. So these are the two main things that I do in facial aesthetics. Do a little bit of threads also. Threads is nothing but putting actual threads in the skin and doing a minor facelift. I would like to hear about what you do in your practice with the surgical aspect, even if the non-surgical aspect, what you all do with the facial aesthetic part.
Sure. So facial aesthetics, I suppose it's different in a younger person and an older person. In a younger person, usually it's more about volume loss. People have a tear trough, they don't have a good enough jaw, those kind of things. In an older person, it's a question of anti-aging, as you said. And in anti-aging, I like to divide it more. People need to understand that there is no one magic solution for anti-aging. There are different components to aging which need to be addressed separately. So the way I look at it is the three big things are volume changes. One is you lose volume in the middle part of your face, you gain volume in the lower part of your face. Second is sagging. Your face sags. That's when you start having these lines and the jowls over here. And the third would be wrinkles from muscle overactivity. You start having forehead lines, glabellar lines, crow's feet. Now, so let's look at this one by one. For volume loss, the two options we have are fillers and fat grafting. Filler being the non-surgical option, fat grafting being the surgical option. I love both. Both have their option. I do both have their uses. I love doing both of them. The indications might be a little bit different. For fillers, the advantage is that it's not a surgery. No downtime. You're back to work. Disadvantage is that it is comparatively shorter lasting. And it's comparatively a little bit more expensive because you're paying by the syringe. In fat grafting, the advantage is that it's much more longer lasting and it's more cost effective. In one surgery, I can put as much fat as I want. I don't have to go per ml. The disadvantage is that it's surgical. There's a little bit of downtime of 4 to 5 days, and it is not as fine an instrument as a filler. So if I'm looking to correct something very specific, like just an isolated tear trough, I would prefer a filler over a fat grafting any day. Or the lips. I don't like putting fat in the lips. I feel fillers are better than fat in the lips. So they both have their pros and cons. What is the next part of it? Next part of it was the sagging. You mentioned the non-surgical option for that is threads. The surgical option for that is a facelift. A facelift is where we make an incision around the ear. We remove extra skin and we close it. So you have a thin scar over here. Which is quite well hidden because it's inside the hairline. Now, which is better when? Usually in earlier facial aging, when it's not so severe sagging, threads are better because it's not severe enough for you to warrant undergoing a surgery. But when someone's has really bad sagging, huge lines over here, a lot of heavy jowling over here, threads will give you at the most maybe a year of improvement and then it goes away. In that situation, I feel a facelift is far better. And thirdly, the last part was wrinkles. This is the only place where there is no surgical option. Botox is the answer. It is simple, it is easy, and there's quite frankly no alternative to it.
Just a few points to add to that. So coming to the loss of volume, and I don't do too much threads in our practice. I'm more of a filler guy. I believe in fillers. I see good results with it. That's what I believe in. So I do a lot of fillers. Coming to one thing, very rightly said that fat grafting is more economical than fillers. One thing that is an advantage of fillers over fat grafting, and I think why they've become so popular over the years, is because they're reversible. Sometimes I see the fat cannot be reversed. I'm not, correct me if I'm wrong, but I feel that fillers, that's one way where it gives the patient a little bit of breathing space, gives us a little bit of breathing space. I'm not saying that it's a good thing that you go correct every of your filler, but it does give you, if there's something that the patient doesn't like, you can go back and correct it. That is my point of view on it. Coming to, yes,
I agree with you on that. And that's why even in fat grafting, I always tell my patients that If I'm going to err on any side, I'm going to err on the side of under than over. It is very easy for me to put more, but if I put too much, it's very difficult for me to take it out. So your point is absolutely valid in that.
Doc, how long? Sorry, Doc, Aniketh, how long does fat grafting last? A lot of patients have asked. There's a question that how long does fat grafting last?
So there are two parts to this answer. One is how much lasts. All the fat that we put in the face does not survive. This is one place again where a filler is superior. You put 5 ml of filler, you know that you have 5 ml of improvement. With fat, that's not the case. Usually around 80% of the fat that we inject survives, but that's a little variable. In some people it's 60%, in some people it's 100%. So some people might need a touch-up procedure. That's the first part of it. The second part of it is that the fat which survives, it stays for a long time. Now, how long, it's a little bit hard to say. I feel comfortable telling my patients that it will last for at least 5 years, but there have been reports for it lasting for 10 to 15 years. But the thing here is that the fat there is dynamic. It is part of your face. So if you lose a lot of weight, that fat will go away. So in that instance, it might last even 1 year. If you lose a lot of weight in 1 year, that fat can get dissolved. So that is the caveat over there. As long as you maintain your weight, it would last a long time.
Perfect. Good. I think when it comes to younger patients, when it comes to jawline sculpting and when it comes to jawlines, I think lips, for jawlines, what do you do, Dr. Aniketh? Do you use fillers for jawline, or when it comes to young patients?
I prefer fillers for jawline because a filler is, especially the higher G prime fillers, they are more firm than fat. Absolutely. So I don't like putting a lot of fat in the lower face in a younger person because that might look good initially, but as they grow old, that thing is only going to sag. So that is not, I would prefer a filler. The one exception is if for chin augmentation. For someone who's looking just for a weak chin who wants to augment their chin, there you have 3 options. You have the filler, you have fat grafting, and you have a chin implant. So I give all 3 of these options for the patient, and I go by what they like. Usually, a chin augmentation is something that's commonly done with a rhinoplasty, because a rhinoplasty, often a nose looks big because the chin is small. So just improving the chin improves the appearance of the nose. So in that situation, a chin implant would be my go-to.
So perfect, very, very valid point. The most important thing when it comes to facial aesthetics is proportion. You might have the best jawline, but if your eyes are not good, you have to balance everything out. So the most prettiest people and the most good-looking people in the world are the ones whose faces are proportionate. Not if you see, so you can't have the best jawline and the worst nose. You have to have everything in proportion. Has to be big lips look like a bigger jawline. So everything with proportions, like Dr. Aniketh absolutely rightly mentioned. So I guess,
this concept of proportions is seen the most in a non-surgical rhinoplasty, in a liquid rhinoplasty. Because think about it, you're actually making a nose look smaller by adding material. You know, it's kind of contradictory. You're adding stuff to the nose, but you're making it look smaller because it's all about proportions. So when someone has a hump and you add material above and below the hump gets flattened and the nose actually ends up looking smaller, even though it is bigger. So this is where the eyes don't see one part of your face. The eye sees your face as a whole and judges things in relation to each other.
That's very true, actually. Even when you do fillers, a lot of people say, I look slimmer. A lot of people tell them that have you lost weight? And you actually need to add volume to make the person look slimmer. It's all the dimensions that you add it in. You don't look at people in 2 dimensions in real life. You look at them in 3 dimensions. So when you change the depth, and the patient actually looks slimmer. Same with non-surgical rhinoplasty, like Dr. actually mentioned. Perfect. I think, there's one last question, doctor. Can you go in for a liposuction after a gastric bypass, bariatric surgery? Can you go in for a liposuction after a bariatric surgery?
Probably no. A bariatric surgery is an example of massive weight loss, as what I said. So if a bariatric surgery has been successful, and my guess is you would have a lot of excess skin. Your body would be smaller, but you would have like curtains of hanging skin. So in that case, we need to do something called a body lift. That is where we have to remove the excess skin. In that situation, if a bariatric surgery has been successful, the patient won't have too much fat. It will be more a question of excess skin, which would have to be treated with a body lift procedure rather than liposuction. It varies. There might be exceptions to this, but as a rule, this is what I would think would be the case.
Perfect. Okay, I think we're done, Dr. Aniketh. Thank you so much, guys. Dr. Aniketh I've He's a very senior plastic surgeon. He's a very, please go follow him on Instagram. He has some beautiful results. He's liposuctions. He's a very good hair transplant surgeon from Bangalore. So thank you, doctor, for coming on and answering our questions. I really appreciate it.
It's absolutely my pleasure. Thank you for having me. And let's do this again sometime.
Yes, please. Thank you. Thanks a lot.
Thank you so much. Bye.
Bye-bye.